The number one mistake with low back pain that most patients make is they're trying to stretch out too much. So they're stretching out, they're doing all these different things, what seems like it may help them and may even feel good at the time, but it actually is making that condition worse. My name is Dr. Cassidy Boelk. I'm a certified spinal decompression doctor and a chiropractic doctor here in San Diego. And for the last 21 years, I've been helping patients get out of back pain, sciatica, neck pain, shooting arm pain, leg pain, without drugs, injections, or surgery, and doing our best we can to make that treatment and that pain relief last. So there's a couple key components with this. Now, when we're stretching our muscles, obviously stretching in some cases can be a really, really good thing. However, when the discs are compressed and they're pushed upon those nerve roots, the last thing we want to do is further stretch and potentially irritate that problem. Now, if the pain in the lower back is not coming from a disc that's compressing, sometimes, yes, stretching can be a very, very good thing for that, okay? But if we have compressive forces and we start stretching, what's the number one thing that I see is most patients are trying to stretch out their hamstrings. And what they do is a real common thing, right? Is we kind of start to bend forward. And as we bend forward, what that usually does with the disc that's compressed, it will cause that disc to further compress and push backwards into the nerve root. Now, obviously, there's some rules to this. Some exceptions to this rule, but in general, that's what typically happens. And then we do that, we cause more irritation and more of a tendency to cause the disc to compress. The disc compresses, it pushes on the nerve root, the muscles tighten, and we just go through this cycle round and round and round again. I've done it before on my own back, before I knew about this. So this is very, very common. Now, what we can do instead is we want to have those muscles kind of relax. So I'm going to show you a simple, easy thing that you can do at home. Now, obviously, this isn't a one-size-fits-all. So if this doesn't feel very good, and as a matter of fact hurts more, then please obviously stop that right away. If this helps you, then it may be something to implement, and you can try it a couple, 2 or 3 times per day. And if your back pain is continually getting better and better and better, then great. If the back pain is staying the same or obviously worsening, then you may need somebody to take a look at that to see what they can do to help with that, okay? So here's the easy thing you can do at home. All you're gonna do is get on a flat surface. You can do it on the floor. In my case, I'm gonna do it on this exam table. And all we're doing with this is we're gonna lay on our backs. We're gonna just give our back a minute here to relax because it may be real tight. And the first thing I'm gonna do is just kind of bring my knees up here. And as I bring my knees up, I'm just going to kind of hold and just nice and easy without falling off of this table. I'm going to rotate side to side, and I'm just going side to side, nice and easy. I'm not going into pain. If I get into pain, I want to stop, okay? So side to side, and I'm just going to rock about 30 to maybe 45 seconds, maybe a minute. And then a real key is when I go to get up, don't do a sit-up. As best as you can, try to roll to your side and then come up that way so we reduce the chances of it irritating and further compressing. Now, if this pain continues to worsen and or starts shooting down your legs, starts to get sciatica, we start to get glute pain, leg pain, numbness, tingling, these type of things, then this pain is getting worse, the disc is further compressing, and again, you may need to see a professional that knows how to actually treat and evaluate these things. In our office, we do a very thorough evaluation so we can make sure whether this is in fact a disc problem, which we may be able to help, or it needs to be referred on out. So if you need some help, go ahead, reach out to our office, try that, see how it goes. If you have any questions, go ahead and send a message, and I'll do my best I can to answer those. Hope this helps.